Hi, how are you? Well, I thought I'd tell you a little story about our COVID-19 vaccination adventure. The other day, I got a call from a good friend of ours that said, if you hurry up and get on this site, there's a chance you can get the vaccine. So I did that. I signed up. I signed myself up, signed my wife up. Both of us were given given a choice of what time we wanted to be there. And this was fairly close to the home, maybe 5 miles. So we were given a choice of what time we wanted to be there. I picked a time, she picked a little bit later, and submitted the form. And right away it came back and said, you have an appointment confirmed for the time we requested, which I thought was great. We had to print out the forms. I think they sent a confirmation. They did send a confirmation saying, yes, you're in. So I printed out the forms so we would have them. And this was for March 1st and March 2nd. So we picked March 2nd because March 1st had a couple of the times that were full. So I quickly jumped to March 2nd and picked a 9:15 in the morning time. So as I say, we got confirmed, we were all set and all excited. So yesterday, as a matter of fact, we got an email saying that whole registration procedure was a mistake. Someone had got in there and posted that on Facebook, which I didn't really know because a friend had told me about it, and that people had signed up from all over the country, I guess, and it was completely in error. They're sorry. You don't have an appointment for March 1st and 2nd. But in the meantime, while that was going on, I got another invitation from local county health service that they were having a clinic on March 26th, and I should sign up, and signed up my wife, I signed up, and they said, confirmed, you have an appointment, but we will send you a text to confirm everything. Should get the text shortly. No text ever came. So, what the heck? Well, no text ever came. So I kind of figured, well, another mistake of some kind, I suppose. I don't know, but I never got a text. This morning, the phone rang. I picked it up, and they said, this is, the name of the group is ComTree. They said, this is ComTree. We're calling you because we had problems with our texting, and you do have an appointment for today. If you can get here before noon, we will take care of you. Well, my wife, in the meantime, is kind of hollering in the background, what about me? What about me? And I hung up before I got a chance to talk to the lady. She kind of hung up. I said, well, we'll just both go. I said, maybe they would have, extras or something. We'll just both go. And she said, well, how come I didn't get anything? We both signed up. I said, I know, but let's just try it. Let's just both go there and see what happens. So we hopped in the car, and we had to be there before noon, and it was about 10:30 in the morning. So we headed out right away. Got there, parked, looked around, didn't see anybody, a few cars there. So we kind of walked up to the building there, and it was locked. So, gee whiz, I don't know. Kind of walked back, I'm going to go around behind the building maybe, and a guy came out from behind the building, and we asked him, isn't this where the COVID vaccine clinic is? He said, no, it's in that building over there, which was a big gray building next door. He said, just go over there. I said, okay. So we went over to the big gray building, walked inside. There was a little sign that said COVID vaccine location. Nobody there to speak of. We talked to the lady at the desk. She gave me a little form to fill out and told her about Kathy, and she said, well, give her a form too, and she can fill that out, and we'll see what happens. So I went back, sat down at the desk with the registration lady in the back, told her about my wife, and she said, oh, if you come, your wife automatically, we want you both here at the same time. So she's automatically registered. We have her name down here. I said, okay, great. Now, I don't know why they didn't tell me that before, but anyway, we were both registered. Went in, got the vaccination, which took about 5 minutes. Had to sit in a chair for 15 minutes to wait. We did that, registered for the next the next shot, which was toward the end of March at the same place, and walked out of there. Nobody really there to speak of. I counted maybe 6 or 7 people. That was all. Nicest people you'd ever want to talk to. They were great. And we've got our first dose, and we're all set to go back for our second dose. And so far, I have not grown another head. I seem to be okay. I haven't seen any after effects yet, and I'm not too worried about that. But anyway, that was my COVID-19 vaccination adventure. You'll probably have one too. So when you do, post yours.
There are certain aspects of being vaccinated and what that means to you personally and your own personal safety and that of your family versus what vaccines will allow you to do in society. One relates to you yourself being vaccinated, and the other relates to the number of people and the relative percentage of people in society that will be vaccinated, because there will be things that you will not be able to do because the burden of virus in society will be very high, which it is right now. Even though we're going way down on the decline that Dr. Walensky showed you, we are still at an unacceptably high baseline level, with the 7-day average being quite high. So there are things, even if you're vaccinated, that you're not going to be able to do in society. For example, indoor dining, theaters, places where people congregate. That's because of the safety of society. You yourself, what you can do when you are together with another person, we are looking at that. And we're going to try and find out very quickly what recommendations could be made about what people can do. One of the things that's universal here that we know, that at this point in time, it is unclear whether when you get vaccinated and you might be protected from clinical disease, which is the primary endpoint of the vaccine studies, that you could conceivably be infected, have virus in your nasopharynx, and at that same time have no symptoms, which is the reason why we recommend and say you still need to wear a mask. Because if you do have virus in your nasopharynx, even though we hope that when the data comes in, it's going to show that the virus level is quite low and you're not transmitting it. We don't know that now. And for that reason, we want to make sure that people continue to wear masks despite the fact that they're vaccinated.